LinkedIn connection.
And I am in the set of All Men.
One particular.
Okay, I'm just kidding.
Oh my god.
Oh! All right.
Dr. Steve was the funniest guy.
If you don't know what isotopes are, they're atoms with different... His own business?
Pause for laughter.
Read the first who wore it best, where the answer was C. My fucking eyes! You look like the last 10 minutes of a garage sale. And I can't wait for even more and more episodes till you... Our next presenter is twice the doctor... But...
All right, we ready?
Yes.
Ready.
Okay. Took me a minute. I think we're ready. All right, let's do it. I won't turn off the air conditioner to the last possible second.
Cool.
And really, in the next few weeks, it'll get a lot better up here. And do you have free time this weekend, any, to help me put a fan in here?
Yes, I do.
Okay.
Sunday,
Okay.
yeah.
Okay. All right. I think that'll help. If we can get a silent fan that'll push air out of here.
Cool.
And I'll have that other fan. I used to have that fan that would pump cold air from downstairs up here.
Oh, yeah.
I think that'll help until things get...
Cool down.
And I got to talk... Remind me to talk about why there's a giant fucking mixing board on the floor over here. Okay?
Yep.
We can talk... We'll talk about, you know, how stupid I am. I'm the stupidest person I know. God, I'm so fucking stupid. There's a drop of that
Yes, there's a drop.
from Boogie Nights, I think. All right. All right, you ready?
Let's do it.
Okay,
Yes.
let's go.
Rock and roll, baby.
Okay. Recording on the wrong track again, as usual. Again, hence my previous comment about being
At
stupid.
least you're consistent.
There we go. It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we have my partner in all things, Tacey. Hello, Tacey.
Hello.
And back from a 2-week sabbatical, it's Hey, Lydia, everybody.
Hey, hey.
Hey, this is a show for people who had never listened to a medical show on the radio. If you've got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347 24/7.
Pooh-head.
Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy that I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Please check out Dr. Scott's website at simplyherbals.net. It's kind of spelled like simplyherballs.net, but it's misspelled if that's what you were looking for. It's simplyherbals.net. And, yeah, there you go. So, hello, everyone.
Hello.
Well, hello.
So I am the stupidest person that I know. And there is a giant, expensive mixing board sitting on the floor over here. And then I have another one in front of me that's exactly like it, right? So last week, when
How expensive?
well, Weird Medicine paid for it. Don't worry about it. It didn't come out of
Okay.
your money. I have to spend some money for tax purposes, so it's a tax thing, but more than I would want to spend for no fucking reason. Excuse my français. But it was last week, if you remember, we were in here and we couldn't hear anything, and I said the USB channel coming from the computer to the mixing board is dead. And I tried everything. I tried pushing every frigging button on this thing, 2-track to main, 2-track not to main, 2-track, all this stuff, USB to 2-track to main, et cetera, et cetera. People who know these mixing boards will know what I'm talking about. And it was obvious that the USB channel was bad. And I didn't have another cable exactly like this one to test my hypothesis. So I didn't have time. I knew the next week I was supposed to be on the Anthony Cumia show, and we had a show here, and all this stuff was going on. So I just bought another mixing board, the identical same one, because I know it works, and I didn't want to have a learning curve with the new mixing board.
But
And this one has worked beautifully for us for years, and I knew it would fail at some point. So it's 10 minutes before I'm supposed to be on Cumia, and I'm setting this damn thing up, just frantically setting it all up. And I set the one mixing board on top of the other one, and then just took all the cables and moved them from the other board to this one. And then I took all the settings and just, mirrored them. And I turned it on, same fucking thing. Now I
boogers.
know I'm a dumbass. So I didn't know this, but on the Apple preferences, you can go to the audio channel for the computer. And there's the USB audio codec. That's what we use to communicate between the computer and the mixing board and vice versa in audio, digital audio. And there's a little button on there that says mute. And you can mute one going in or going out. And it's like, how did that get clicked? I've never seen that before.
Oh, geez.
There's no way I clicked that.
Oh, I did.
Oh,
Tacey,
there
God
you go.
damn you.
It's her fault. Yay. for
Always
Tasty,
tried
yay
to
for Tasty.
sabotage.
This is my favorite place to be, is up here on this lovely
messing
floor.
with my equipment. No clue how it happened, but I felt so stupid, but also so relieved.
Yeah.
So now this is the new one that we're using, and I've got the old one. It'll just be a backup when this one goes bad. So,
Cool.
Anyway, what an idiot. So let's go from being the dumbest person in the world to something more awesome. And we're killing a little bit of time because we can't call Lady Diagnosis till after 4:30
Oh, yeah.
our time. So it's just in a couple of minutes. I thought most of you know I've been plugging the Rochester Creep Off show. And this was one of these things where most of the time when Carl asked me to do something, Carl from the Creep Off, he's also the owner and the CEO and the host of Who Are These Podcasts.
Isn't it his birthday today, too?
No, that's Mr. Cardiff. I forgot to say that. Happy birthday
Oh,
to...
we busted you last week.
Well, that wasn't his birthday last week, but seriously, it is his birthday this week. It's crazy. So, happy birthday, Mr. Cardiff. Carl usually surprises me, like at the Nashville show. I didn't even know I was going to be on the stage. I just thought I was going to have a good time. And he's like, oh, here's your assignment, 24 hours ahead of time. So I had no fun the night before because I was pulling clips and trying to be funny and all this stuff. And that was the most nervous I've ever been, was getting on the stage in that Nashville show. More nervous doing that than I was doing Opie and Anthony because I felt unprepared. At least at Opie and Anthony, there wasn't anything I was supposed to do. And I did okay. I got a couple of laughs, but I didn't feel satisfied with it. This time, they gave, and mostly, I will say this: it was mostly Vinnie Paulino. I think he was running this, and he gave me 2 months' notice. Mm-hmm. So I give Carl credit because he's the co-host, but I think the reason I got time to complete my assignment was because of Vinny. And anyway, so I was supposed to do anywhere between 3 and 6 minutes doing a roast. And I've never done anything like that. Mm-hmm. I'm not a funny person. I know what's funny, though. And why do I know what's funny? Because I listen to Opie and Anthony. And Tacey and I have talked about this before. That was like comedy, and Ron and Fez, too. Mm-hmm. It was like comedy college. Ron and Fez was sort of surreal comedy, and then Opie and Anthony was more, East Coast sort of this is how comedy works stuff. But if you listened carefully to it, they would dissect jokes and tell you why this didn't work, why this did work, all while having fun. It wasn't like sitting in a college class. It was hilarious. Mm-hmm. And the thing I liked about it is, like, if you listen to Bob and Tom, who we also loved, but if someone bombed on there, they would just blast right by it. Whereas on Opie and Anthony, they'd go, whoa, 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 what?
Oh, my gosh,
and then
I want to listen to that.
Yeah, and then Anthony would hit the car crash noise, and then sometimes they would talk about why that sucked so bad, and you would learn what works and what doesn't work. So I've been a student of this. It fascinated me. And going to the cellar when we started going up there, and remember that time we went up there and we saw Jim at the comics table with his laptop working on his art. It was amazing to see, the amount of time and attention that they put on writing jokes. Mm-hmm. and making themselves just be funnier people. So I studied that, and I always wanted to know what that felt like, to get up in front of people and just make them laugh. Just me by myself. But I didn't have the time. I'm not going to go do open mics and do all that shit. I just don't have time to do it. So I figured it would never happen. Mm-hmm. But it was a bucket list thing. I wanted to feel that.
Right.
Just one time. So, Vinny kind of gave me that opportunity. So I had 2 months. I started writing jokes the day he told me. And some of them were okay. Some of them weren't. Some of them are still in my set. Some of them are long gone. But I contacted several of my comedian friends. Bobby Kelly, I said, will you help me? And he hooked me up. He said, no, dude, call these guys. And, one of them charged me $150. I didn't use any of his jokes, but it was very nice of him. But it kind of stimulated. It was fine. It stimulated. I knew what I didn't want to do. Mm-hmm. And that's not a bad thing. It's not to say the jokes were bad, but he didn't know these people. So then I went to people who did know him. So Rich Voss knew Vinny because he'd worked that club before, and Jim Norton knew Carl because he had done WATP, and both of them agreed to help me. Now, Voss, I called him on the phone, and he just started ripping off one joke after another, just, and it was, I was like, stop, I got to write this shit down. And then Norton was more deliberative. He said, let me get back to you, and about a week later, he sent me a page of jokes, and I used some of them. Like, he sent me one that said Carl should quit smiling so much because he looks like a Nazi propaganda poster. And I didn't, I knew where he was going with that, and it was kind of funny. But Tacey and I both said we don't want to be doing Nazi propaganda jokes.
But Jimmy could get away with that.
Jimmy could get away with that. I couldn't get away with that. But I used the idea, and I changed it completely. I wanted to introduce the topic of Carl's teeth. So I said, let's talk about the elephant in the room, not you, Vinny, because I was going to do a whole bunch of fat jokes. I'll get to you in a minute. Carl's teeth. Carl's teeth are so Carl's teeth are so bad he looks like an English brothel or something like that. That was just to introduce the topic, and then I had a bunch of really strong jokes. And so I was massaging these jokes the whole time because, again, I'm not funny, but I know what's funny. Now, I did write some of the jokes. Some of the ones I wrote were better than others, but one of them I wrote really landed really well. I was very proud of myself. And I just wanted to not suck. And that's what I kept telling Vinny. I just don't want to not suck. I just want to not suck. And I'm going to play a little bit of it. I'm not going to play the whole thing because it's behind a paywall, and I don't want Vinny to send me a cease and desist for playing copywritten material behind his paywall. But I do have just a couple of seconds of it. But then I want to play the thing that makes me the happiest of all of this. Hang on just a second. Now, this crowd was amazing. By the way, we had 3 people who were fans of our show that were there. It was Sean Pedrick, Amanda Davidson, and Greg Rogers.
Oh, cool.
And Greg had emailed me, and I'm not going to say why because he didn't want it, necessarily for me to talk about on the air. Sure. But I said, you should come to this thing. I've got a VIP table, and I've got 4 seats there. And then Sean and Amanda won them just by, raising their hand at the right time in the chat room, kind of. Yep. And it was cool to have them there. I had people that I knew were there because they liked our show too. Awesome. But anyway, so here, this is just the beginning of it. I'm just going to play a minute because I don't want to get a cease and desist.
I have to say that I'm very grateful that you guys let me be a part of your... Andy, everybody!
Wait a minute. Okay, here we go. That was Trucker Andy.
Our next presenter is twice the doctor that Dr. Phil is. Unfortunately, that number is still 0. Everybody give it up for Dr. Steve!
This will be mostly painless.
This won't hurt a bit.
Vladimir Putin. Oh, I'm sorry. Wait, that's for the Tom Myers roast. Hey, that's an in-joke. Dr. Steve from Weird Medicine. I'm the oldest person here. I'm about as old as Joe Biden. I read an article recently that said age contributes to memory loss. It also contributes to memory loss. Pause for laughter. Read the line twice. All right. Thank God that went over. I was really nervous. Phew, thank God. I first met Carl because of my job in radio. I also work in hospice, which is the job I wish I met him at. There were meet and greet tickets tonight that were $80. Tickets without a meet and greet were $100. Okay, that one's okay. Good. I started checking them off with my pen. Let's talk about the elephant in the room. Not you, Vinny. I'll get to you. Carl's teeth. Yes, he has worse teeth than an English brothel. You always know Carl's getting ready for bed when he's in the bathroom putting toothpaste on a jigsaw. Okay, I really can't play anymore.
No. But you did, that was awesome.
But if you want to hear the rest of that, it's on the Creekball Patreon. They've got a really inexpensive Patreon. Maybe someday they'll put the video up. And it was so much fun. And let me see. There is one other thing. This is the thing that made me the happiest because I talked to our friend, maybe it was Stacy I was talking to him about. He said, now you're going to just be doing comedy all the time. I was like, no, that wasn't the point of this. This was a project. I had an assignment. I just wanted to not suck. And that's it. I'm fine. I never need to ever do this again. Mm-hmm. And I don't want to ever do it again. But that feeling... I'm going to tell you, halfway through, I started having a little more fun with it too. I was a lot less nervous. And like Tom Myers, I started laughing at my own jokes, and that was bad. And I would get rid of that if I could. But I'm an amateur. You got to cut me some slack on that. But it was just for me, a bucket list moment, and I really appreciate Carl and Vinny giving me the opportunity to do something like that, because it really meant a lot to me. And I could almost croak right now, and it's like, okay, my top 3 things, Mary and Tacy and having our kids, the number 1 greatest joy of my life. Number 2, the greatest achievement, probably, not my publications. I've got a lot of publications and stuff. That's cool. But creating this system thing that we did. I mean, we've got a huge medical system, and we did a really neat project with that. And that's number 2. But no, this would be number 3. This is up there.
That's pretty big.
So anyway, this is what really made me very happy, was when Cardiff Electric, who was there, who, by the way, is a fucking genius. Mm-hmm. And I posted a picture on my Twitter, and if you look at it, he always comes in with the Michael Myers mask. It was 1,000 degrees in there, and he was in character the whole time with this Michael Myers mask and like his really heavy jacket. I thought he was going to die. And it was funny watching him when he would actually get tickled at something. You'd see Michael Myers, laughing. But he stood in the back of the room for the first hour, and they actually called the management thinking something bad was going to happen.
Oh, no.
And the guys who were running it had to say, no, he's fine. He's fine. But I have this picture from the stage looking out into the crowd, and it says zoom in, zoom way in, and the farther you zoom in, all of a sudden you see Michael Myers standing in the back of the crowd. And he was brilliant. I don't want to go into it too far, but I've already said more than I probably should on this show. But anyway, I wanted to play this because this is Carl and Vinny talking about this on their show, I think just recorded today. So,
And Dr. Steve was the funniest guy on the dais.
Yeah, no one saw that coming.
No one saw that coming. He has no confidence. He's constantly like, I don't know why I'm even here. And
he
then he gets up there and
rope-a-doped all of us.
He crushed all of us.
Yeah.
It was fucking amazing.
Rope-a-doped us. He pretended he was all rubber-legged, walked up on the stage.
Yeah, I know.
And then he just starts winding up jabs. Holy shit, he destroyed.
Speaking of roasting.
Anyway, so.
Well, you put a lot of work into it.
Yeah. And you helped me a lot, too.
I did not.
Yes, you did. Tacy practiced with me, let me practice with her more than once. And you helped me with those, with those jokes, too, telling me which ones, because I had questions about stuff. And you told me, I don't think that's going to work or this will work and stuff. And I appreciate it. So, but anyway, there you go. So the roast of Carl and Vinny at the Creep Off Patreon, patreon.com/the Creep Off. All right. Let's take just a second here, and I'm going to turn off the equipment, and then I'm going to get Lady Diagnosis on the phone so that we can do Tit Talk with Lydia. It was Tit Talk with Tacy, but now it's Tit Talk with Lydia.
Mm-hmm. We could be both, right?
Yeah.
Well, I had a different procedure.
Yes, that's true.
All right, here we go. All right, let me get her on the phone. I need to check that audio when I played that because it looks like it was overmodulating. Okay, it's okay. All right. All right, everybody. We're going to call old Lady Diagnosis. Old Lady Diagnosis. She would appreciate me calling her that. Well, it's funny, and she's heard me say this. I always tell the comedians when we have comics in coming to town, she drives them around. I pay her a couple $100, and I say, well, we'll have a supermodel drive you around. And they're like, oh. And I say, well, an aging supermodel, but a supermodel nonetheless. So.
Is she really a supermodel or just looks like one?
No, she's just tall, and she's tall, blonde, and
big booty.
Yeah.
Big breast and well dressed.
Never heard that.
I've never heard that. Okay, save that for the show. Wait a minute. Let me get her on the phone here. How are we going to do this? Let's see. What in the fuck is going on here?
Never heard that before. What in the fuck?
Okay. Why? Oh, what's new in Skype? Yeah, what's new in Skype is you can't find any of the people that you're supposed to call. Shit.
Hey, Joe was asking who your other favorite person that you met at the roast was.
Oh, well, besides Sean and Greg and Amanda, that's a hard one. Somebody that I hadn't met before was Pat Dixon, and he was really a sweet guy, which is not what you would expect. Hang on. Necessarily from watching him, but he was just as nice as he could be. And, just meeting all the people that really enjoy what Carl and Vinny are creating. And hang on. Okay. Obviously, we're not recording this, so
Did you drink that whole thing today?
How do I make a fucking phone call, Skype? Jesus. Oh, new call. Okay.
It's all vodka.
Is it?
There it is.
A little
okay,
bit of
now
tea color in it.
I wish they wouldn't.
To the
Oh.
bourbon barrel.
Thank you for calling Collins Studios host and call. Yo Blood, enter your 6-digit PIN number. Welcome, Dr. Steve. You is now in the host room and can manage your funky callers from the call-in studio web interface. Laws you is a mess, dat for show.
Okay, whatever. All right. Stupid robot. Oh, I could have turned on the air conditioning while we were doing this.
It's good to lose some weight from sweating.
Yeah, it is good. Okay, I have no mobile network. What in the hell?
Oh, shit.
I know. Just hang on. I should have done this before the show, but I got here right. You were so proud of me being on time. All right, here we go. And my whole goal in life is for Tacy to be proud of me.
No, I think that's accomplished.
You think?
I think so.
Okay, we're calling her. Now, this board has never done this before, so I want to make sure that we can hear her and everything. Hey.
Hey.
Can you hear us?
Yes, I can hear.
Okay. And if I play this, can you hear that?
No.
The boo sound, you couldn't hear that? Okay.
Uh-uh.
Oh, I know why. It's on the same channel you are, and I've got it turned off. Okay. Yeah, so you can hear everything but sound effects. That's something I'll have to fix in the future. All right. Are you ready?
I'm ready. You tell me what to do. Are we starting?
Yeah. We're just going to bring you up.
Okay.
I have to get... Okay, that we don't need. Are you driving home?
I'm driving to Bristol.
Oh, you are? Okay.
Yep.
Oh, there we are. Okay, now we're good. Okay. All right, so PA Lydia is here. Have you guys met?
We have not. It's nice to meet you. Thank you for coming on.
Okay, I'm going to go ahead and
Oh,
start.
it's nice to meet you.
Okay, I'm just going to tell you. So what we're going to do is we're just going to introduce you right off the bat. And PA Lydia is, we're just going to talk about your breast implants, basically, or your breast augmentation.
If you don't mind.
We're going to talk about your giant tits.
Your boobs.
Okay?
I'm so excited.
Okay, here we go. All right.
Okay.
Okay, on the phone we have Lady Diagnosis. Hello, Lady Diagnosis.
Hello, Dr. Steve.
So good to hear you on the phone. We have PA Lydia here. I don't think that you two have ever met.
Hi, Lady Diagnosis.
Hi, Lydia.
So, and Tacey's here, and
Hello.
Dr. Scott.
What's up?
Hey, guys.
So, sorry we couldn't have you here in the studio because we're going to get Lydia to like touch your boobs and stuff, but we'll do that another time.
Rain check.
So she is thinking about. So this is my plan: is I'm going to have 3 different people in the studio. I've got you who had like normal implants or augmentation. Then I have a friend who had what we're going to refer to as a more extreme version, and then we're going to have one of Lainey Spizer's clients on who has just monster implants. And because Lydia isn't 100% sure that she's going to do it. Now, she's had a kid. You have one kid,
I have
right?
one child, yep.
And can we talk about the other thing that's going on with your life?
Yeah, I don't care.
Okay, well, she's not with her husband anymore.
Yeah.
And she came in here and she used to make jokes about herself being in the itty bitty titty club and all that kind of stuff. And then all of a sudden that kind of her tune kind of changed. Now, you and her have similar body types. So, and probably similar, you both of you forgot to grow boobs during high school, I guess. And so I was just wondering if you could just talk about your journey when it comes to, getting your augmentation and all that kind of stuff.
Well, yeah, that's awesome. Can you hear me okay?
Yeah.
Yep.
Okay, because I keep cutting out on you. So, I just decided one day that I was tired of my sundresses not fitting and not being able to wear sundresses, which was the main reason I got boobs.
Why can't you wear a
But
sundress?
I didn't want them.
This is something that a guy would
no
understand.
boobs.
So if you wore a sundress, what would happen? It would just hang open and people could see down your shirt? Is that what it was?
It just didn't fit right, so it wasn't cute. It was just, it was ugly on me.
Okay.
And I can't.
Yeah, Lydia's.
Yeah, I feel you on that for sure.
Sundresses, it's a small window of women who can wear them.
Yeah.
You got too big.
Right,
if your boobs are too big, you can forget it. And if you don't have any, you can forget it.
Yeah.
Interesting.
You get the gap.
Yeah, where it's just hanging open.
Yeah. But I will say the advent of the breast pedal has been great for small-breasted women.
What the hell is a breast pedal?
It's like a little sticky gel thing.
Oh,
so
and
cover
you
your
actually lift.
nipples. Well, so I just figured out that you can lift with it.
Yes.
I just figured that out this year. Yeah. But that's enhanced my sundress experience. But yes, she's on point.
Yeah. Are you wearing one now? Are you wearing?
I'm not.
a
I'm wearing
breast pedal
a
now?
sports bra.
I'm wearing a
with no padding.
I'm wearing a breast pedal now. So I just
We
didn't
figured you were. Yes.
I wanted to pretend like I didn't know what it was.
Yes. We're just acting.
Yeah. So since you had it done, talk a little bit about the procedure. And you are cutting in and out, and I don't know what the problem is. It's I think it's on your end, but I was sort of hoping that you would be at home by the time I called you. But can you sort of walk us through the procedure itself? And then whether you've been satisfied with the result.
Well, I did it strangely because I went to like an hour and a half, 2 hours away to a doctor. And so my first visit was my consult, and then they took me right into surgery.
Holy
so I had
crap.
to have all the Yeah. And I had no follow-ups, nothing.
What?
So,
I love it.
But didn't really get a chance to feel out different sizes either, because I think that's more what they do in the pre-ops and in the consults. So I just went in thinking, I was really like not even in an A. So I went in thinking, okay, I want to be.
Yeah.
And then she says, oh, well, no one's ever said, oh, I was too big. Okay, well, I'm the one, because she went ahead and put me up into a high C. In some Victoria's Secret bras, I'm a D, and I wanted a B. So, and that was kind of my fault because I couldn't get there earlier and do all that stuff.
Yeah, that's interesting, isn't that?
I definitely recommend trying on, if you can, implants in a bra to see how it feels carrying that.
But you don't look out of proportion.
No.
Like ridiculously out of proportion.
No.
I was going to say that you just went, you're my example of a normal, when I say normal, I mean, there's nothing
Typical.
abnormal. Typical, yeah, thank you.
Yeah, and I'm used to it now. It just took me a long time to get used to it because it's not what I had expected.
Yeah.
And it does fit my body, but, where I'd been flat for so long, and I was a runner, I exercised, and they were in my way, but, I muddled through. But I'm glad I did.
So when you run now, are you like Andy from The Office screaming, "My nipples, my nipples"?
No, it's funny. When I do run, I just carry them.
Oh, that's hilarious.
So I don't run anymore. But, like if I'm doing aerobics, I literally will have one arm under my boobs just holding them up and do the, with the other.
They don't make things for that? Isn't that what sports bras are for?
Well, you have to get a really, really, really tough one to hold those babies in.
Wow.
And they're hard to put on, too.
Yeah. Yes,
Zip
and
'em
get
up.
off. Oh, my God, getting them off.
This is fascinating to me.
I
This
will
is all
say
stuff
it's
no
like,
guy has any
it's
experience
so
with.
easy having
Except
small
for
breasts.
one podcaster that I know of that is.
Yeah,
He
it's
has a
just
guy
so
that-
easy. I don't have to think about it. I don't have to wear a bra. I can just wear one of these little teeny bopper sports
Yeah, why bother,
bras.
right?
That's awesome.
Yeah.
Interesting.
Well, you're going to miss that, but it's worth it. You'll miss that part. But then again, there's sometimes you can go without a bra because you have boobs now and you don't have to lift them off your belly button like I did.
Yeah. Well, that sort of sounds like having an A cup and you say, oh, well, you don't have to do this or that. It sounds like when women get the real short haircut and go, oh, I don't have to do anything
To
anymore.
fix it
you know?
anymore. Yeah.
Yeah, it's like, no, just keep the long hair.
That's
It's
a good
cooler.
parallel.
Except your hair can grow out.
Suffer a little, yeah.
So you would
Yeah,
do it
true.
again.
Oh, yeah.
You would do it again.
Oh, God, yeah. Yes. But I think I should have probably got it under the muscle because I feel like, and I don't know if they are or not, like they're kind of drooping down a little now because they're kind of heavy, and I didn't get them under the muscle. So that's one suggestion I would make.
That's what I hear from everybody, particularly if you've got A cups and you're going to something larger, a B or a C, that you get it under the muscle. But you want an artist too to do this. You don't want just some.
Absolutely.
Yeah.
Diane, what kind of benefit did they give you for having it over the muscle? Like, how did they talk you into that? Or did they give you the option?
I just heard it was less painful, and that's really I think that was, and there might have been a slight cost difference. I think it cost a little more to go under.
Yeah.
And I was already, strapped.
Yeah.
So I took the cheapest option, less painful. So I had two little kids.
Yeah.
I was still having to run around and chase them, so I didn't have help.
Yeah.
So I had to hurry up and heal. So those were my two issues.
Yeah. Hey, let me ask you this. What about the downsides with the unwanted attention from men? All of a sudden, guys who never noticed you before are like, whoa, what do we have here? What about that and the creepy guys?
I know. That sucked. No, it was funny because right after I worked in a factory when I had it done. And so the guys there, they were like, so what happened? And I'd be like, I'd take my two fingers and take them at my eyes and be like, pull them down to my boobs.
Oh, yeah. That's
so
funny.
instead of
Nobody
looking
ever
me in
does
my
that.
eyes, look at my boobs. Yeah, exactly. And they would just
That is
crack up.
hilarious.
So I loved it.
Yep.
I love
My boobs are down here, boys. Why are you looking in
I
my
know.
eyes?
That's exactly what I'd say.
That is hilarious.
Huh. Okay.
All
I mean,
right.
I paid for them.
Yeah. And did you get saline or silicone? That's my last question. Saline or silicone, Diane? Well, uh-oh.
I got silicone, but I don't know what the difference is.
Yeah, okay.
Really.
No, that's okay. For a while there, they weren't doing silicone because of the Asia syndrome. It is so rare. But actually, the person we're going to have on in 2 weeks actually has silicone implants. They did not leak, and she still has Asia syndrome. And that is that, autoimmune syndrome caused by adjuvants. And silicone is one of the things that's considered to be one of the offending agents in that. So we'll talk about that. And, I want somebody in here to talk to you about the extreme downside, extremely rare as it is. I mean, I've been doing this for, I've been in medicine 37 years. I've probably seen, I know one, and maybe two in my career. And I've seen lots of people with implants.
But I've heard. I worked at a plastic surgeon's office, and
Right.
he said even if they're leaking, doesn't matter what kind they were. He never asked, so I assume it was fine either way. The body's not going to have any kind of an issue with that being in and
Unless
it's not
they
going to
do.
just float around really.
Unless they do, though.
But
There is a very
not
rare
common.
syndrome. Right. No,
Yeah.
it's extremely
Right, it's
rare.
not common. Yeah.
Do you have any
Yeah.
like?
So he would have people.
Sorry, go ahead.
Oh, he would just tell them, I would say, oh, my God, their boobs are, leaking. And I'd want to get them in the next day. And I'd check with him because, he's booked out months. And he'd go, no, he goes, they'll be fine. He goes, there's no problem. There's no emergent issue with if your implant does blow up or explode or leak out.
Explode?
So that's comforting. Well,
What were you going to ask?
Do you have any numbness after the procedure, like any like areolar
question.
numbness or like other paresthesias or abnormal sensations in your breasts?
I still am kind of numb a little bit. Yeah. It took a long, long time for the numbness to wear off to where I can feel.
When you say numbness, you talking about nipple
I don't know.
numbness? Because if you're nipple centric,
Just around the.
go ahead.
I'm feeling them right now, so excuse me. No, I mean, there's not a lot of sensation the nipples still hurt if you pinch them, of course. But
Yeah. Okay.
really, I don't feel much there.
All right.
But that doesn't bother me.
Any other questions, Lydia?
No, I think that's good. So you're overall quite happy. Maybe go a little smaller so you don't have to hold yourself while
That's
you
her.
exercise.
No, you need to go as large as you want to. Don't listen to
I
her.
don't
on
want to
that.
go large.
Don't listen to him.
Exactly.
All right. Hey,
Do what you want to do.
thanks, Diane.
Thank you.
Well, Lydia, we need
you.
to hang out and touch breasts one night.
Yeah.
Yeah, let's do it.
Oh my God.
All right.
He's so bad.
All right. Bye,
See you,
Diane.
Dee.
All right, bye.
Bye.
That delay we had was rough.
Quite something.
Yeah. But worked out. Worked out okay.
Yeah.
So now, Tacey, you had a different procedure, which we've talked about, where you had a reduction mammoplasty. But you had some numbness as well. Is that right? Because they had to take your nipple off and sew
Yeah,
it back
no, but
on,
I
right?
have all the feeling that I
It's
used
all
to
back
have.
to normal.
Yeah. Mm-hmm.
Yeah. Good.
I'm very fortunate
Yeah.
to have that.
Well, and you had a good surgeon too. Mm-hmm. Okie doke.
Okay. Yeah.
So in
Part
2 weeks.
one.
Yeah, that's
In
part
two-
one. In
okay.
2 weeks, we're going to have a different sort of story for
Okay.
you. Okay?
Yeah.
All
Thank
right.
you,
Good
guys.
deal. All right. Any questions from the waiting room, Dr. Scott?
Not yet.
No? Okay.
No.
Any? They're all mesmerized.
Yeah, they're all like, huh?
She's touching her boobs right now. They're bigger.
They're already bigger. Just talking about it. All right. You guys want, so we have some question, or we have a topic that was very interesting. That's kind of apropos in that it's, did you
Female
bring
related.
it? But it's female related.
Yeah, female centric, right?
Yep.
And
Did
I
you-
think you're one of the experts on this.
Thank you. How did you know that? You've been listening?
I remember you saying that one time.
Oh.
Oh, don't
You knew I was
listen
an
to him
expert
and
because I
what
said
he's
it.
an expert on.
Yep.
There
No, I
you
am,
go.
though. I am. This is one of the things. Even Joe Rogan's partner, Brian Redban, somebody had brought something up and it was trending on Twitter. And he tweeted out, Dr. Steve settled this ages ago. You need to talk to him, and I really appreciated that. Brian's good feller.
Yeah.
But anyway, so it's
The
about
topic is female ejaculation.
excellent. So you wanna take it? I was gonna.
Yeah.
Okay.
We
yeah.
can,
go.
I can intro and then we can talk about it.
Yeah.
So, no, I will give you credit for sending me this article, right? That was recently published in the International Journal of Urology.
Excellent. So it's not some shit journal.
Correct. Yeah, it is a peer-reviewed journal.
Yeah. Well, I mean, International Journal of Urology. It's not one of Dr. Scott's, alternative medicine journals.
Shots fired.
Watch it now.
Okay, so the title of this is Enhanced Visualization of Female Squirting.
Yes.
It's amazing there isn't a better phrase, like a better term.
There is. It's called coital incontinence, but that's okay. Let's see what they're talking about, because we have discussed a certain kind of visualization that they did with ultrasound, where they discovered that coital incontinence, aka true squirting, not as opposed to female ejaculation, is a distinct syndrome. It's not a syndrome, but it's a distinct condition that, because people say, well, it's just piss. Well, okay, it depends on how you define piss. If piss is anything that comes from the bladder, then yeah, it's piss. But it's not urine. It is unless you define urine as anything produced by the kidneys that's then expelled by the bladder, then it is urine. But it is not like any other urine. It is physiologically completely different in that it's only produced during sexual stimulation of certain women, and their kidneys turn on, and it's probably a brain thing. You've heard of diabetes insipidus? Mm-hmm. Okay, so diabetes insipidus, people pee out free water because they lack the antidiuretic hormone that is a thing that causes them to resorb free water and just pee out waste products and solutes and stuff, unless they've got too much free water and they pee that out. This basically is a case where they have diabetes insipidus for a short period of time during sexual stimulation, where they will only produce extremely hypotonic fluid, which is basically free water, which is why when you have guys that are down there, doing their thing, eating at the Y or whatever you want to say.
Eating at the Y.
Okay. 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 Performing when people are down there performing cunnilingus, and
there we go.
And then they have their girlfriend who squirts. And they like it. They say it's not piss. It doesn't taste like urine.
Oh,
because
God. It's so disgusting.
And that's why it tastes like free water, because that's what it is. Okay. So anyway, so that's the background of coital incontinence, which is, by the way, distinct from female ejaculation.
Yeah.
All right.
So we are moving specifically to female ejaculation for this.
Oh,
for this.
really?
Well,
from the Skene's glands, or is this?
This is from the Skene's glands.
Oh,
proposed.
now this.
So,
okay. So let's talk about that just for a second. We know that there is prostatic-like tissue between the labia majora and labia minora, and that's these Skene glands, and they will produce a white milky substance in some women, and some women will do both. And that's female ejaculation, and they'll do. Some women will do one or the other, or some will do both, or some will do neither, which is what has confused people over the years. And the difference is, if you test that fluid that's coming out of those Skene's glands, it will have prostatic-specific antigen in it, and urine will not. So there you go.
Yeah.
All right. Okay. Now go.
So the purpose of this study was to elucidate the mechanism of squirting.
Excellent.
Yeah. And so what they did was take 5 women who were not sex workers.
Okay, good.
But who had the ability to squirt.
Why didn't they use sex workers?
I don't know. I don't even know why they had to say that.
I know. Right. Just 5 women.
5 women if they want to be sex workers.
Yeah, right. 5 women who were not attorneys at law.
Against their will.
Right?
Yeah. They were not against their will.
Well, I guess they didn't want to think that they were
study.
paying them and exploiting them, I guess. Okay.
Yeah. So what they did was they took these 5 women. 2 of them were in their 30s, 2 were in their 40s, 1 was in her 50s.
Excellent.
And they placed a urethral catheter, so they put a tube in through the urethra, into the bladder, emptied the bladder through the catheter.
Yes.
And then instilled a mixture of an indigo and saline, so like a colored.
It's a dye.
Yeah, dye solution. Just 50 cc's of that, or 50 milliliters.
Which is very small. That's two teaspoons, right? Is a teaspoon 25 mLs?
Teaspoon is 15.
No, wait. No, a teaspoon is 5.
30.
So it's 5 tablespoons to 5 teaspoons.
Yeah, so just a small amount.
5 teaspoons would be 25, so it'd be 10 teaspoons.
Um,
No, shit. Wait.
I think a tablespoon's 30. Anyway, it's not that much.
A tablespoon is 30. That's right.
Yeah.
So you said they put 50?
They put 50 total.
So a tablespoon and a
half.
And right.
I'm glad
somewhere
we
in
wrapped
there.
that up.
Jesus.
And
wait,
then they-
5 a
Oh
teaspoon
my God.
is 5 ml. So
Yeah.
it was 10 teaspoons.
teaspoons.
I had
Thank you.
50 mLs of fluid pulled out of my knee once.
Really?
If that matters.
Yeah, that's pretty
it's
cool.
the same
It has
amount.
nothing to do with anything. But
Same amount.
So did it hurt?
Instilled into these bladders.
Did they, it might have been the same fluid.
It might have been the
Did
same.
it hurt when they did it?
It hurt like an MF. Oh.
So then they proceeded to perform sexual stimulation.
Okay.
To
Did they say how
facilitate
they did
squirting.
that?
Yes. Specifically, 3 only required manual stimulation and 2 required penetrative.
By themselves?
stimulation.
They did it themselves?
They did not. They did not state that.
Oh my God!
but-
See, I'm just imagining what these guys are
Yeah,
like.
and I
Okay,
did
now
not pay the $50 to the full article, so we
Okay.
are reading the abstract.
Oh,
as
the
published.
abstract's fine.
Yeah,
All
yeah,
right,
yeah. So apparently, it does specify that these women had to have the anterior vaginal wall stimulated.
Okay. See, science is
Basically,
fun.
so, anyway, so then
Casey's like nerd when when I'm watching science stuff on YouTube, and it's like, no, science is fun. This is exactly why.
the stimulation was videotaped.
Oh,
Excellent.
For verification.
And watched later.
And watched. And then the secretions were collected in sterile cups.
Sorry. That's
And then they took said
inappropriate.
cups
Okay.
and checked them for PSA.
Okay.
So all
We
5
did
women
this
were
experiment.
able to do this to, score.
And the
That's
reason they
just such a
instilled
weird
the reason they instilled the bladder with indigo was if this stuff had indigo dye in it, this fluid, they would know it came from the bladder.
Yeah.
That's pretty tricky.
In all cases, the discharge fluid was blue.
Oh, it was.
It was in all 5 cases.
So it did come from.
It all came from the bladder, and it was
But it had PSA in
PSA
it.
positive in 4 out of the 5.
Okay, so we know the reason why. Because it was contaminated by fluid from their Skene's gland, so those people had both coital incontinence and female ejaculation.
Correct.
So
Thank
thank you.
Yeah.
And that's it?
That's basically
Well,
it.
I thought they were doing enhanced imaging. So what was the imaging? part?
No, the imaging part was actual visualization of the squirting.
Oh, for God's sake! So
Yeah.
they got up there and looked.
Yeah, they got you
Can
with
you
that
imagine
mass spectroscopy tag on the photo. Like on the link you sent me, there was like a nice it made it look like we were about to really see the components.
Oh, yeah,
you
yeah,
know?
yeah.
And that's not the case. So visualization.
Can you
was-
imagine these scientists with their white lab coats and pocket protectors, and this woman is somehow stimulating her anterior vaginal wall, and they're just up there like 6 inches away looking at it, all crowded around.
I mean,
Can you
it takes a
imagine?
special lady.
It does. One that's really interested in science.
I mean, she's really contributing to science. here.
Yes. Wow.
Yeah.
thank God.
So in
Okay,
conclusion,
so we didn't learn anything more than we knew before. Okay,
Well,
yeah.
their conclusion: the main component of squirt fluid is urine, but may also contain fluid from Skene's glands or the female prostate. I think that's a reach, right? They
go to-
didn't specify urine.
Well, okay,
From the bladder.
blue stuff, but it's not. Okay, it just depends on how you define urine. Again,
Right.
Go to drsteve.com, put in female ejaculation. You can read the story about it. And I wrote up a whole thing summarizing the evidence in the literature. And the reason there's confusion is because some people do both. And in these people, 4 out of 5 of them did both.
Mm-hmm.
So most of the fluid was blue. So that means it came from the bladder. So how do you define urine? Well, what was interesting about the other studies were they looked at the specific gravity of the fluid, and it was 0.0. I wish I had that drop from Dean Wormer.
That ain't urine.
0. Damn it. If I'd known we were doing this.
Fat, drunk, and stupid.
Yeah.
There's no way to go through life.
Mr. Blutarsky. Mr. Blutarsky. 0.0.
I love
the
it.
greatest movies ever made. But
Hey, so was there-
yeah, that ain't urine. I mean, you can do that, but it's usually a pathologic state, or you're just hyperhydrated. And this is special fluid. It is water. It's made by the kidneys, and it gets to the outside through the bladder. So you can say, yeah, that's piss, but it ain't piss in the way that we think of piss.
Right, in the smelly sense.
I think of piss
smelly,
as being,
salty sense.
Right, smelly, salty urine.
Any difference in the amount of fluid released between the age groups?
They did not.
The younger versus
they
the older?
really need to. I kind of want to pay for the
Post,
article.
Yeah.
If they've had babies or not babies.
Or was there greater than 50 cc's of fluid secreted?
Yeah, I
Right?
guarantee you there was.
If the older ones had,
The study we did on the old Anthony Cumia network, that woman secreted gallons of fluid.
Oh my
It was
gosh.
it got started
God's
and it
sake.
didn't stop. And that's the other thing.
Oh.
No one is making that much urine. You just can't pee that much. It was just constantly flowing. For the whole time
What
that she
did
was
you
stimulating.
do
Are they
on
like
that
lying?
show?
Well, I was here, and they did it there, and
Oh.
Bobo had a doctor's outfit on and was collecting the urine with they made him a collection thing with a urine collection cup on the end of a ruler, and they taped it on with like duct tape, and he was down there collecting this fluid, and then they tested it. I had sent them some test kits for PSA, and they were basically, those are used in rape analysis and other things like that, where you're just trying to see, is there something that came from somebody's prostate in this fluid that's in here. And but we repurposed it for this other thing, and I showed them how to do it, and I walked them through it, and lo and behold, that fluid had prostatic specific antigen in it. Dr. Harry Fish had gotten another adult film actress in his office, and he'd only done half the study, because he tested the fluid for urea and said, yeah, it's just piss. It's just piss. It's like, Harry, he's not a scientist. He's a clinician, and that's not the science. That doesn't tell you anything. What that tells you that some of the fluid came from the bladder, but it doesn't tell you whether there is female ejaculation in there. So you got to do both. You test for urea and for PSA, and so he'd already done that part, so I did the other half, and there you go. And all we did was just confirm what was already in the medical literature. It's very clear what this really is. And if you look at that one study, it talks about how this fluid is different than normal urine. So,
Did you say what rate of women do that?
it was anywhere between they estimated between 7 and 50% of women.
I think 50's a reach, right?
Yeah, I
Unless
think
people
50
just
was a
don't talk
reach.
about it.
7's too low.
Yeah.
Unless it's
Okay.
just a teeny bit that nobody
You just
notices.
don't really know that.
Yeah. Yeah, the stuff that we're talking about, you couldn't miss it. I mean, these women have to have intercourse with, layers of towels on their bed.
Wow, that's
One of those
something.
waterproof.
And a waterproof cover.
Cover
Yeah,
on the
because it's
mattress.
just everywhere. It's amazing.
I'm thinking through the logistics of this as if
Yeah,
I
I
need
Yeah.
to
too.
deal
It's
with
bad.
it, but I
It's
don't.
bad.
Yeah, no, be glad.
I'm glad.
Yeah. So, although the people
Got
that do, they love
have
it.
small boobs, but I don't have to do it.
There you go. Well, then.
Give yourself a bill.
God does not give with both hands.
All right. You guys want to answer some questions
Well,
while we're
Scott
here?
has something I would like
Oh, okay.
for him to go over. This new
All right.
COVID booster shot.
Okay, let's talk about
Number one thing, don't take advice from some asshole on the radio.
which is appropriate for if we're going to talk about COVID boosters.
The
and
Omicron
stuff.
specific COVID
Yes.
booster shot.
Yes.
Side effects, is it worth doing? What
Yeah.
are the recommendations?
So what have you got, Scott?
Blah, blah, blah.
Well, I've got the side effects from the re-engineered COVID vaccines.
Yeah, and it's going to be the same as the other one, but what do you got?
Well, thankfully, both Pfizer and Moderna's BA1 shots, they're showing pretty much the exact same thing as we had in the original shots.
Yeah.
Pain, fatigue, headache, muscle pain, chills, joint pain, redness at this swelling site or injection site, and possibly a short course of fever.
Yeah.
Which
Okay,
is
so-
kind of what we had originally.
So what they're doing though is that kids, they're still expected to get myocarditis, and they do minimize that because all those kids that got myocarditis,
Got
with
better,
very
didn't they?
few,
For the most part, yeah.
a few exceptions, got better. And the disease still sucks. I have okay, I got to be careful. I know somebody that was at risk. Okay, admittedly at risk, but a young person at risk. So you can imagine, what risk factors they might have had. You just figure it out. And they got COVID for the second time, vaccinated twice, boosted once, got COVID once, had not been boosted again, but got COVID again, and now is having to go to a post-COVID clinic because they've got all kinds of after effects. But Jimmy Dore talks about this on his show. The people who need these things are the people at risk. It's the elderly. It's most of the time.
What about overweight?
Well, yes, but it's people who are over their life expectancy, and if you're grossly overweight, you could be over your life expectancy at my age. So if you are at risk, you should absolutely get one. I'm trying to decide whether I'm going to do it, and hell, we may get our YouTube channel taken down because I haven't decided exactly yet if I'm going to do it yet. But, I've been boosted. I had a complication from COVID, and I was in the trial. I got the thing early, and I had a badass case of COVID during Delta, and now this stupid Omicron. And but we're not seeing, it's not shutting down the hospitals like we were. We're not seeing. I mean, you've seen that.
Yeah.
You remember in the peak of it during Delta, particularly, and OG COVID, when we were just shutting down wards and just shoving people on ventilators in those, and we're not seeing that. So
I remember I think often I would diagnose COVID and say bye to the patient.
Yeah. And now,
because those pre-vaccines, our cancer patients
Yeah,
had 25% death rate. So.
yeah. So what we're seeing now is people are coming into the hospital for a procedure, and they tested positive for COVID. So we're going to see more on that. Obviously, make your own decision. Talk to your healthcare provider. If you're at risk, definitely get one. If you're not at high risk, think about it. We've got some time to think about it before this thing hits the market. Anyway, all right. Thanks, everybody. Thanks to everyone at SiriusXM, and thanks to our listeners. Go to our website at drsteve.com. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. Shit, I got to do that again. All right.
I thought it was already on the market, Steve.
The new booster is on the market?
I thought
It is?
It was.
Well, they were supposed to call me the second it was on the market. Can we check that?
I thought Ingles was given the new one.
They are? Okay. Well, I'm going to fix that then. I wasn't aware of that.
Is it the bivalent Omicron?
Yep. Mm-hmm.
Yeah.
It's out?
FDA approved it on the 31st
of
August.
Oh, okay. All right. Well, I'm an idiot then. How am I not up to date on that? Well, I've had a few things going on. Okay. Yeah. Okay. All right. Let me back up then. I got to say that differently. Let's see. Talk to your healthcare provider. If you're at high risk, definitely get one. If you're not, it's something to think about, but consider all the risk factors, risk benefits, and alternatives before you make a decision. Thanks to everybody listening today. Thanks to all of our friends in the waiting room. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. There we go. Okay. Is that
Nailed
okay,
it.
you think?
Yes.
Nailed.
I just, I'm not 100% sure I'm cool with this thing. But I don't want to discourage people from getting it either if they want to get it. So
I think you conveyed that quite well.
okay, thank you. And we can talk about it more on the podcast side. All right. Any questions from the waiting room, Dr. Scott?
We do have one question.
Okay, excellent. Any comments from the waiting room? Anything anybody wants to say? Or?
No, they just think you're awesome.
Well, whatever. They do not. But thank you. Oh, Cindy Walker had it. She had it on Monday.
Okay.
See, Cindy Walker, could you call in? And we'll have you. I'll start this thing back up again.
It's hot.
I know.
Hot potato.
I get it. Okay. Cindy Walker.
Call quick.
We could have you next week.
Call next week.
And email me, drsteve202@gmail.com. We'll set it up. I would like to have somebody that's a listener who had the bivalent booster.
I've been thinking about getting it.
I'm thinking about it. I'm not saying I'm not going to get it. I just haven't decided yet. You know?
Are you going to get a flu shot?
Fuck yeah!
I'm a super slacker.
Well, let's talk about that because I got news on the flu shot front.
Flu shot?
Say that 5 times.
Flu
real
shot
fast.
front?
Okay, you guys ready? We'll just do it right now.
Do it right now.
Let me see where we could break in there. I'll figure out. I'll find a place where we can just break in. I do want to talk a little bit about the influenza vaccine. I got a call the other day. Do you want to be in the Pfizer mRNA universal influenza vaccine trial? And I was like, do I? Can you imagine?
Nope.
You're not going to do it? Was that a nope? What? That you wouldn't do that? A universal influenza vaccine. I would jump at that in a second. To never have to have it again.
Yeah.
So I'm not 100% sure it's universal, but that was what they implied to me. But I'll let you know. But it's an mRNA influenza vaccine. I don't see why it would be, 4 quadrivalent when you're doing it with mRNA. Why would you do that? Do a single universal protein that you can attack influenza with, and it's done. Kill it for once and for all. We got one strain during COVID. We killed it through social distancing. That one was so fragile it needed people to be close to each other to be transmitted, and it was I can't remember. It was influenza Yamaguchi or something.
So many people would say, "Where's the flu?"
Yeah.
Patients, where's the flu?
Yeah. No.
I'm like, it's because you're wearing a mask.
Yamagata.
Behind your mask.
It was Yamagata.
It's exactly. It's behind.
Influenza B Yamagata, and it's gone. And you know who else said, "Where's the flu?" Infectious disease specialists. We have an infectious disease specialist in our hospital who, he normally takes care of all the influenza patients. During, the second year of the influenza, we didn't have any.
No.
I think maybe he saw 2 patients. And he said, if this is what it's going to do to influenza, because, the original R0, the transmission number of OG COVID was 2.4, which meant one person could infect 2.4 people in a vulnerable population. Influenza is only 1.2. So all that social distancing that didn't, maybe it flattened the curve a little bit, but the shutdown surely didn't do anything, for society, but F it up. But what it did do is it destroyed influenza.
Yep.
And influenza Yamagata is gone. I wish I had TAPS because another one. Smallpox, influenza Yamagata, 2 out of the way. 2 down, 6 coronaviruses to go. A couple of Marburg type, RNA viruses like, Ebola and Marburg and stuff like that. Get rid of those. Rabies, you're toast. Measles, toast. Fuck yourselves, you fucking fuckers.
Dirty viruses.
I hate them.
Yeah,
Let's just reproduce inside a human body for no reason.
Make 'em sick.
Prions should be shaking in their boots.
Yeah, and then the prions are next.
Yeah.
They can kiss my
Coming
ass too.
from you for you.
But just don't eat cow parts when they've been shaking a lot. That's the thing. All right, and so getting back to this COVID vaccine thing, do what you think you should do. I'm not here to tell you what to do, but we will give you data when we have it. And if you are at high risk, if you're at risk of complications from COVID-19, you should get vaccinated. I will make that blanket statement.
What are they saying about if you got all Pfizer before? Does it matter, or does
the common wisdom has been that it doesn't matter.
Okay, with this new one,
yeah, that it doesn't matter, but that's common wisdom. Not common wisdom was that thalidomide was a really good drug for sleepy, for
Sleepy
vomiting,
pregnant women. Yeah.
and insomniac pregnant women. So, I'm not saying this is the same situation, but we have to be careful
analogy.
about. Well, but you have to be careful about common wisdom. Period.
True.
Just because something seems to make sense, it doesn't always make it so. All right.
okay.
What else we got to do?
Got one last question.
Okay. Yeah.
Amanda Davidson says,
Amanda Davidson? The delightful Amanda Davidson.
delightful. She was asking if this is something women are born able to do, or do they develop this ability?
Are you talking about squirting?
Yeah.
Yeah. Able to do is probably a weird way to put it. They're, cursed by it, some women would say. And others would like it, I guess. So I guess, yeah, able to do would be. I don't think it's a learned thing. And it's not, these women aren't necessarily incontinent either. They're only incontinent during coitus or sexual stimulation.
At one point, my ex did some research on this.
Because he
quite
wanted
fast. Yeah, he thought it was inducible.
He wanted you to do it?
Yeah, it was not successful.
Good. What kind of things did he do to you?
He had researched and felt that it was inducible.
So how did he try to induce it?
Stimulation of the anterior vaginal wall.
Oh, yeah. Well, of course, because that's where the bladder is. What he was trying to do was empty out your bladder the same way you would empty out a prostate, by just increasing the pressure and decreasing the volume of the bladder. But if you don't have a giant filled up bladder with hypotonic fluid in it, it won't do anything, because you're like a clean person and you would have urinated, avoided your bladder before intercourse if you had a minute.
Mm-hmm.
If you had warning it was coming.
Yeah.
Yeah, so that's...
And I'm pee shy anyway, so...
Yeah. We should talk about male pee shyness sometime. I have a cure for it. Howard Stern has it. I would want him to call in, but I know he wouldn't do what I told him to do, and he would just go off on a tangent.
You can't pee in the ocean, though.
No, I cannot. I am pee shy in the ocean, but that is temperature controlled. I think that the water is a different temperature than my body, and it just shuts everything down. But I used to not be able to pee like at a concert. Like if I had to go real bad, I couldn't go in a stall if there were other dudes around. And I'd have to wait till everybody left, which would piss people off, because like, dude, I need to piss, and you're just standing there for 10 minutes. And then if somebody came in, it would interrupt it. So let's put that on the agenda for next time. And we'll talk about that, Dr. Scott.
Sounds good.
Because I have a cure for it, because I no longer suffer from that.
I'm excited.
Ooh, a little teaser.
We'll do it.
The teaser. All right. Thanks. Always go to Dr. Scott and to Tacy and P.A. Lydia. In 2 weeks, P.A. Lydia will be back. We will be discussing her journey to breast augmentation. Thanks to everyone who's made this show happen over the years. Thanks, Carl and Vinny, again, and producer Chris and everybody that was associated with that show for letting me have a really, really fun moment that I'll never forget. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com. I almost forgot our website for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you.
Bye.
Okay, let's do the intro, and then we'll be done. Scott, do you have time to play, or do you have to go?
No, yeah, I
Okay.
can.
All right, you guys ready? We'll do this real quick.
Who won the race of princesses? Rapunzel. By a hair. Okay, here's number counter. That would really be a lot of numbers. Please try again with different criteria, or say, help, for more information. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50. Okay, here's number counter. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. Why did the art collector buy an old septic tank? It's filled with mass turd pieces. Why did the farmer trade cow manure for goat poop? It was a dung deal. Where does chocolate milk come from? A dairy cacao.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, a traditional Chinese medicine provider who gives me street cred, the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
And back from a 2-week sabbatical, it's P.A. Lydia. Hello, P.A. Lydia.
Hey, y'all.
Hey, this is a show for people who never listened to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347.
Who-head.
Follow us on Twitter at Weird Medicine or at drscottwm. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Well, all right. We had a couple of technical glitches there, but here we are. Please don't forget stuff.drsteve.com. Stuff.drsteve.com makes a huge difference. Stuff.drsteve.com for all of your Amazon needs, or you can just go to drsteve.com and click on store, I think, and it will take you. You can click through to Amazon, or you can scroll down and see cool stuff that we talk about on the show all the time. And check out Dr. Scott's website. It's simplyherbals.net. You got the CBD nasal spray back in stock?
I got it up.
Okay. It's selling like proverbial flapjacks?
Flapjacks, yes.
Okay, very good.
And actually, it's we've got everything straightened up on the internet, so we're back in business.
Okay, good deal. Good deal. Check them out. Simplyherbals.net. Buy it just even if it's just for a goof. Buy it though.
Yeah.
It's not expensive.
No.
You got stress less and reprieve.
Fatigue reprieve, baby.
Guilt reprieve. You need guilt reprieve.
There you
That
go.
would be a good
I'll
one.
get some fatigue reprieve.
Yeah, really?
Yeah.
You have any with you? Hey, PA Lydia
buy
can give us a
some.
review
Oh,
next time.
Yeah.
Okay. And then check out our show on Patreon. It's Tacey and me and sometimes a celebrity. And it's exclusive questions. You call in there. It's guaranteed your call will get on. We will do 100% of calls sent in by our Patreon members. Patreon.com/weirdmedicine. And then if you want me to say fluid to your mama, I will do so. Go to cameo.com/weirdmedicine. It's like $6. And my my niece Holly did it for my sister Martha, and I got to say a few choice things on that one. That was loads of fun. And instead of sending her a birthday card, and Holly paid for it, so there you go. It was awesome.
I'm sure she missed the birthday card.
She didn't miss the birthday card. She doesn't give a shit. She probably
Those
is
people
still
like their
pissed. I
cards.
know. And if you don't send her a thank you note, oh my
for
God,
God's
my sister.
sake. Thank
She's
you
very
note.
strict about that. But anyway, she's 100 years old, so I guess that we can cut her some slack. You know, I think actually my sister, is going to be 80. Can you imagine? I think my sister, I'm going to say that again. I think my sister is going to be 80.
That's pretty old.
Okay, let me try that
Wow.
again. My sister is going
Wow.
to be 80. Okay, that's what I was going for anyway. All right. Okay, there you go. That'll get started. Yeah, we're going to play music. Lydia, you going to hang around with Tacey for a while?
Yeah. I'll
Okay.
be down there.
All right, that was good. I thought that was kind of fun. Did you
That
like
was
it?
good, yeah.
Okay.
I got a cameo from my partner, the business partner.
Oh, yeah?
the work
From
partner.
who?
There was some like Instagram
Oh, like
video
a-
that he sent me.
Oh, yeah?
Like a porn model.
Oh, yeah.
person. And he
What did
sent
she
me
do?
a post, and I like did a cameo for him, and
How much was it?
it was like $10. She did it immediately, and I was making him like bald jokes and stuff. It was fun.
Oh, yeah, good.
It was good. That was a good one. Yeah, I like cameo.
Well, yeah, maybe now that I'm a roaster, I could roast. No.
Yeah, cameo roast.
I've always wanted to get a cameo from somebody off of Howard for Brooke because she's such a Howard.
Oh, yeah. Well, you know, I did that for Beck and Liam. I got him High Pitch Eric.
Yeah, I think High Pitch Eric would be great.
And his prices have come down now.
Oh, really?
Yeah, because he's not on the show as much, and he's like, whoa, you know, I had this gravy train for a while, and then I got Fred the Elephant Boy to do a Christmas thing. That Christmas I had to work Christmas. I got Fred the Elephant Boy to say hello to Liam and Beck. Yeah, of course they couldn't understand a thing he said. Okay, we'll be down a little bit. I have got to figure out how to work this reverb on this thing.
Oh, yeah.
I don't know what I'm doing wrong.
Is it not like the last one?
Yes, it's exactly
That's what
the
I thought.
same. So let me look at how I had this done.
Reverb.
Okay,
reverb.
up, down, down. Aha.
Reverb,
okay.
reverb, reverb.
Okay, and then that is
reverb.
Up, up. Okay, both of those are up.
Reverb.
And that should be it. Oh, wait a minute.
That's not a bad sign.
No, okay, I have to send it to the pre-mixer. That's what it is. God, I'm dumb.
Losing shit,
sometimes.
brother.
I am a dumb person. Okay,
Dumb
let's
boy.
see if this does it. Okay, let me hear myself and let me see. Hello, hello. No, it still isn't doing it.
Hello.
Why? Okay, I worked out the mix minus for okay, going to the main. Okay, wait a minute. Okay, that. Main mix is down. Well, I wonder if I have to set some parameter or something. Maybe that's what it is. And I'm not doing that. Maybe that's all it is. Hang on. I want to do a special shout out to our friends Patty Blue, Amanda Davidson, Colin Carnes, Sean Pedrick, I see you in there, my friend. Richard Kish, excellent. I mean, I made some real friends for life at this thing, and that was cool too. And it's always cool when you connect with people in this universe, and they turn out to be really cool people. Let me, this is going to take a second.
They seem nice. They seem very nice.
Yeah. Stereo aux returns. That shouldn't be. This is FX to main mix. Okay, I don't care about that. That shouldn't matter. Hello. No, keep playing.
Oh, sorry, yeah. That's what I was trying to give you some noise.
Okay, what are you plugged in? You're not plugged into anything?
No, this is straight.
Yeah.
Straight mic.
Okay.
Straight vocals, yep. Straight microphone.
Keep doing it. Okay, that's the program. Here's the parameter.
Test.
No reverb. Try it now.
Test. There we go. Now we're getting something.
No.
Oh.
Okay, I'm sending to the
Test.
FX machine. There's the fucking FX. Oh, wait a minute. Am I stupid? Try it now. wonder if the FX engine on this one is just blown.
No. Hell, some of it's brand new.
I know. But it doesn't make any sense. I mean, God dang it. Okay, going. Source goes to the main mix. 2-track USB. Okay, FX should go. I'm channeling it to the main mix. And I'm seeing activity on it. Now I'm turning it off. Now I'm turning it on. Nothing. Well, okay, I'm not gonna make it wait.
Test.
We're just gonna have to do it without, and I'll do some research.
That's just weird.
It is weird,
especially since it's the same.
Yeah, it's the same mixer,
same deal,
same settings. Everything's the same.
Probably something on your computer you accidentally clicked again.
No, this can't be. This is mixer dependent.
Oh, yeah.
And we had it working.
Yeah.
But it wouldn't record. So I don't know if anybody else could hear it.
Oh.
See, when I put it on solo, see?
Do it again.
Oh, wait a minute. Okay, wait a minute. Try it again.
Test.
I don't want to solo the returns.
Test.
Because when you do that, you can't control it. So the reverb engine is working, but I can't route it for some reason. Okay. What are we going to play today?
We'll play.
Hey, you guys that listen to this live, still make your podcast thing download it, will you? All right.
You want to, you feel like a little, Bright Side of the Road.
How's that go?
I'm going to email it to you. Little darling, come with me. Help me share my load. Because you probably haven't been playing anything, have you? Not much, anyway. Not much. I don't think we've ever played it.
Have we ever played what?
Bright Side of the Road from Van Morrison?
No.
I don't think we have either.
Okay. You emailing it to me?
Yeah. You should have it any split second now. Okay. We had a couple of good requests from.
Oh yeah, let's hear them.
We had Crowded Table.
We did that already.
We did that.
But we could do it again.
We did Dirty Flowers.
Oh yeah. Dead Flowers, you mean?
Yep. Who said Dirty Flowers? Love it. I think she meant Dead Flowers.
Okay, does this just do the same thing over and over again, or is there some weird ass shit in the middle? Because this won't fit on my screen.
No, it's pretty much the same thing all the way through.
Okay.
Let's do.
We can do this. I'll try it.
Yeah, let's try it. Let's do one first. Let's do Dead Flowers first.
Okay.
Just since we know it.
All right.
Let me find it.
Do we?
Let me think. Yes, because we're experts at it. Dead Flowers. If I can pull it up. If I can pull it. Because have you been playing anything?
Nope.
I hadn't played.
No, I literally for the last 2 months, the only thing in my extracurricular time was
writing jokes.
Yeah.
Well, it paid off. Sounds like you were quite the superstar.
No, not at all. But it was loads of fun. And hearing Carl and Vinny, who I really respect, say that they liked my set, it was really something.
Yeah, that's pretty cool.
And I was watching Sean and Amanda and Greg. And they were really, I was playing to the whole crowd, but I wanted to make sure that they were having a good time. because I'm the one that dragged.
Yeah,
I dragged them.
I was gonna say poor things. They didn't have a fighting chance, did they?
No.
They All right, let's pull up Dead Flowers. They must have had a good time. That's really good stuff. How about some Dead Flowers in D?
In D?
Well, when you're sitting there in your silk upholstered chair, talking to some rich folks that you know. Well, I hope you don't see me in my rag company, 'cause you know I could never be alone. Take me down, little Susie, take me down. I know you think you're the queen of the underground, and you can send me dead flowers every morning. Send me dead flowers by the mail. Send me dead flowers by my wedding, and I won't forget to put roses on your ring. Well, when you're sitting back in your rose pink Cadillac, making bets on Kentucky Derby Day, well, I'll be in my basement room with a needle and a spoon and another girl to take my pain away. Take me down, little Susie, take me down. I know you think you're the queen of the underground, and you can send me dead flowers every morning. Send me dead flowers by the mail. Send me dead flowers by my wedding, and I won't forget to put roses on your grave. Take me down, little Susie, take me down. I know you think you're the queen of the underground, and you can send me dead flowers every morning. Send me dead flowers by the mail. Send me dead flowers to my wedding, and I won't forget to put roses on your grave. No, I won't forget to put roses on your grave.
Ugh, been too long since I played that.
I say you sound pretty good.
No,
you were getting
that
those
was
old
awful.
fingers cranking. I like it.
Terrible.
I like it. Yeah, that D is. I don't know why I decided to play a D. I guess because
No, that's a good key to play.
It wasn't bad. Yeah, it wasn't
I can
terrible.
play that in that key.
It wasn't terrible.
I'll tell you what, we went to see the Isotopes. I didn't talk about that.
Huh.
It was so good. And of course, you know, I go there going, well, I'm not going to drink no alcohol, and ended up just like, you know, standing in front of the stage going, fuck, you know, those,
getting wild.
Anyway, I'm sorry.
I love it.
have to apologize to Greg, Amanda, and Amanda.
I
Greg,
love it.
Amanda, and Sean for my behavior.
Yeah, Sean, I'm glad you guys had to watch him for a weekend. He can be hard to handle. Hey, what do you think, Sean? Was that almost in key? Almost. Yeah, Dr. Steve was getting funky and letting loose. I know he was. I know how he is. Did you get that email?
Oh yeah. That's what I'm saying. It doesn't fit on my screen, but
Yeah,
I can figure
it's
that.
just the same because you can get diverse, and
Okay.
of course it's the same thing. Yeah. We'll go.
I don't know what it sounds like, so go ahead and start.
Yeah.
and
So just I want. From the dark end of the street to the bright side of the road, we'll be lovers once again on the bright side of the road. Little darling, come with me. It'll help me share my load. From the dark end of the street to the bright side of the road. And into this life we're born, maybe sometimes then we know why. And time seems to go so fast. In the twinkling of an eye. Let's enjoy it while we can. Let's enjoy it while we can. Help me leave my love. Help me share my love. From the dark end of the street to the bright side of that road. My scroll's not working.
What are you doing now?
I'm just getting back to the F. So, and we're into this life we're born. Sometimes we don't know why. And it seems to go so fast. In the twinkling of an eye. Let's enjoy it while we can. Help me sing my song. From the dark end of the street to the bright side of the road. From the dark end of the street, you're supposed to whistle this part. Dark end of the street to the bright side of that road. There you go. We'll be lovers once again.
Yeah.
The right side of the road.
Thanks.
Little darling, come with me. Help me share my load. From the dark end of that street to the right side of that road. Well, that was brutal. That's a good little song, though. Yeah, you forgot to sing the background vocals.
I didn't know. I never heard this song before.
Oh, you not heard it? That's
Never.
it's an old Van Morrison song.
Oh,
that's a good little.
It says
thing.
here Jerry Garcia band.
Well, yeah, we did the Jerry Garcia. We did the.
We did the
Jerry Garcia version. Of
Jerry
course we
Garcia
did.
took a shit, and then the turd played the song. That's what we did.
Yes, well, that's exactly right.
Yeah, I would promise I'll practice for next time. I have not been practicing at all.
And we get those fingers moving, baby.
And I'll have some reverb for Scott.
Yes, anything to make me sound less like me. Let's do one more. Let's do
Okay,
one more.
what do you want to do?
Let's do something we know. What are we really, really great at?
Nothing.
Yeah, that's true. That's true. How about oh yeah, we hadn't done in a while.
Series of Dreams.
Ooh, no, we have not done that in a while. You want to try that one?
No, because we won't remember when it goes to the.
That's true. You want to do Deal from the Grateful Dead?
What?
Deal from the Grateful Dead.
I don't
It's been a
know
while
that one.
since we played that.
Well, how's that go?
It goes it's in G and then it goes to B and E minor. No, that's too many changes.
What? No, it's okay. What is it?
Since it cost a lot to win, even more to lose. I don't.
Wait, no, wait. Is that C?
Yeah, I've just got it. That's a bad key for me. Hang on, let me try it in A.
Uh-oh.
No, let's do something else. Let's do something else fun.
That's a good song, though. We used to play that.
Yeah, but hell, I can't do it right now.
All right,
my brain's not there. Let's do something. We can do a little. Have we ever done Tangled Up in Blue?
I don't think so.
That's what I was doing just a second ago.
Okay, let's do that.
Yeah, you can. This is it's an A.
I can't believe that we put our friends through this.
Oh, I can't either. I can't.
And that they put up with that.
I think they.
Why
enjoy,
is this fun?
I think it's they like watching a train wreck.
It's Schadenfreude, isn't it?
They like watching.
Do you know that word?
Schadenfreude.
Yeah.
I do. I can't remember why.
It means enjoying other people's pain, basically, or their misfortune. Okay, Tangled Up in Blue.
Right. Oh, wait a minute. Nope, Sean's got a good one. Box of Rain. Thank you, Sean.
Box of Rain?
Yes, thank you, Sean. We're going to do Box of Rain. We have done Box of Rain. Dr. Steve does not remember because it's been a long time. Box of Rain.
Okay. I'll tell you right now, I'd do about anything for any one of those three. That was there.
Oh yeah, man! I wish I would.
They really.
I
that
would
was
love
so
to
nice
be
to
with
have that kind of support at that level during that. Oh, I do like this song. Now we need reverb for this, but I'll play it. What chord? What key do you want to play it in?
So this is going to be version 3. It's in.
Version 3.
Yeah, so it's A, but it starts off in D. Look at.
You're at Ultimate Guitar.
Yep. Look out of any window any morning.
Well, that's a great song. Yeah.
Any day.
Okay, let's not fuck this up. That way we gotta be serious
Maybe
about
the
this.
sun is shining. Is that too high for me, Steve?
No. But we could try it down lower if you want.
Yeah, let me go down one notch. Let's go to
Box of Rain version 3 with an asterisk next to it.
Yep. Look out of any window. Look out of any window.
So what are those chords? The D instead of the D and the A minor. What is that?
An E. B
Okay.
minor.
Oh wow. So E and E minor and B minor.
Or we can do. Look out of any window.
I think you could be a little higher than that, but anyway.
Yeah, let's try it. Let's try it in the E.
Okay. Look out.
Yeah. All right, here we go, Sean. This if we screw it up, it's your fault. In E, so 3, 2, 1, and look out of any window, any morning, any evening, any day. Maybe the sun is shining, the birds are winging, no rain is falling from the heavy sky. What do you want me to do for you, to see you through?
Wait a minute, are you playing the right chord there?
Yeah, E.
No, it's F. Oh,
F sharp. Yeah, F sharp minor. 2, 3. Yeah. So go.
See you through.
Yeah. So let's go back to B minor. So to see you through. For this is all a dream we dreamed one afternoon so long ago. Walk out of any doorway, feel your way like the day before. Maybe you'll find direction around some corner where it's been waiting to meet you. What do you want me to
watch it sleeping.
Then please don't be surprised when you find me dreaming too.
Yeah, we're gonna have to work on that.
Yeah,
one.
hell
That's
no.
a good song.
That's a
though.
good song. All right, Sean, we're gonna stop it.
Yeah, we'll work on that one
before it gets any worse. Let's do one more we do know. Yeah, Sean, we'll get
put
that
that
one,
on
I
the
promise.
list.
That is on the list.
I've added to my favorite.
Yeah, I've just got to find a better key.
Yeah, okay.
That just was all over the place. And that is a terrible thing to be when you're supposed to be not all over the place. You know, we hadn't done forever. This old cowboy. Remember that one?
Well, I was thinking on a series of dreams.
Well, there you go. Nothing. Nothing. You gonna sing it?
No, I don't know the words.
All right. I was thinking a series of dreams where nothing comes to the top. Everything stays down where it's wounded. It comes to a permanent stop. I wasn't thinking of anything too scientific, like a dream when someone wakes up and screams. Nothing too scientific. I'm just thinking in a series of dreams. A minor. Dreams where the umbrella is folded and into the path you are hurled.
Okay, wait a minute. Sorry, it's A.
A minor, yeah, A minor, and F is C folded, and back to A minor. A minor, and into the F you were C. One more time. And the cards are no good that you're holding unless they're from another world. I was thinking in a series of dreams where time and tempo drag, and there's no exit in that direction except for the one you see with your eyes. Wasn't thinking of any intricate scheme. Nothing that would pass inspection. Sorry about that. Is thinking in a series of dreams. Back to chorus. Dream where the umbrella is folded and into the path you were hurled, and the cards that you're handed are no good unless they're from another world. I'd already gone the distance, just thinking of a series of dreams, just thinking of a series of dreams. Just thinking of a series of dreams.
It's a great song.
Great
Not
song.
very well executed on my part.
Poorly played and picked and sang, but that's okay though. All right, guys.
It's been too long since we played. I don't think we played last week.
The dude from Cracker. We can actually do we can do a Cracker song next week too.
Cracker.
Yep. All right, boys and girls. Ladies and gentlemen.
No, I don't have my
People
funk
ball
on.
leaders.
Shut up, Patty. No, I got my shit peripheral neuropathy on. Thank you, though. You're
He's got
very
a swerve
nice.
on.
You're
That
very
and Working
nice.
Man Deads are my two favorites. American Beauty and Working Man Dead. Sean, you have good taste, brother.
Yeah.
CC, take care. Kush, yeehaw, baby. See you ends in a week.
Bye, everybody. You're good.
See you ends.
They sure are. Surely are a bunch of kittens out there, I'll tell you that. Looks like they've got into the corn
Thanks, love it.
squeezins a little bit.
Thanks, love it. Thanks, Kush.
Little bit
Thanks,
too
Amanda.
much. Yeah, I think that was a
Amanda,
good
thanks
show.
for taking care of the old man while he was in town.
Yep.
Making sure he took all those vitamins. All right, see you guys.
Bye.
See you next week.
We love you. You surely are kittens.
Goodness. Oh man, I just kicked off that damn Box of Dream in the wrong key, and it went downhill from there.
Oh, no, well,
Oh,
if we
Lord.
practice every once in a while, we might actually could entertain somebody, but we're just entertaining people by looking
so bad.
terrible. Yeah.
Well, the great thing about us is we really don't care.
There's nothing great about us. You know the great thing about us is
we don't care.